United Healthcare coverage denials are coming into focus as the murder investigation of United Healthcare CEO Brian Thompson continues. And while we still don't know a motive, we do know that earlier this fall, United Healthcare was the subject of a Senate probe into insurance companies intentionally denying people's claims for profit.
And recently, an NBC affiliate investigative team reported on some of the people and families impacted by those United Healthcare denials that were investigated by Congress. None of it excuses this murder or the flood of morbid comments that followed online. But an industry expert did say that backdrop also can't be ignored. Kent Erdahl has more.
As soon as the details of United Healthcare CEO Brian Thompson's murder began to emerge, two thoughts immediately came to mind for Ron Howrigan.
Obviously, the first thing reaction is what a tragedy to see somebody's life ended like that. And that was the initial reaction. Very quickly after that, the first thing that hit my head was, this is a disgruntled member. This is somebody who has likely had a claim denied or some personal issue with United Healthcare and has decided to take matters in their own hand and seek revenge.
Howrigan wants to be clear. The investigation into the shooter and his motive is still anything but clear. But his reaction is based on much more than a gut feeling.
This is a pretty rigged system, and the consumers need to understand that, and they need to push back on it.
He's provided insight into insurance denial investigations by Care 11 and many other outlets, thanks to 38 years navigating the industry, first as a healthcare insurance executive and now as the founder of Fulcrum Strategies.
We work with physicians all over the country, helping them with their managed care contracts.
So you used to work on the insurance side, now you work with doctors to navigate the insurance side?
Yep. I sort of switched sides. So I've seen both sides of that equation and table. But I was really getting very disconcerted with the Wall Street pressure to continue to make more money, what that was doing to how we treated our patients and how we treated doctors.
And with NBC now reporting that deny and defend were among the words written on shell casings discovered at the scene of the murder, it set off alarm bells.
What did those words mean to you?
It stems from the fact that it's a weird industry where when your customer uses your service, you lose money. And so there is an inherent profit motivation to avoid paying claims. And the best ways to do that are delay, deny, and then defend your position on why the denial occurred.
Now, at a time when United Healthcare has already faced mounting scrutiny from lawmakers and the courts, he just hopes the public will let the process play out.
I don't want to see this happen to any other human being, regardless of whether the industry has some things they need to fix. It shouldn't happen. But I think this points to the fact that it's reaching a boiling point where something has to be done.
If people are frustrated with this system and navigating it, what do you tell them?
First of all, I tell them that don't just give up. You have, as a patient, a lot of appeal rights. Talk to your state Department of Insurance. Talk to your employer who's paying the ultimate bill for this. Don't just give up. Definitely don't take matters in your own hands. That doesn't help anybody. And especially now in the days of social media, make your story known. Don't give up. Keep pushing for it, because if it's really needed care, you just can't, let that go by the wayside.